Okay, welcome and thank you for attending Taking Public Health Action for Family Caregivers. This event serves as an overview and a release for the framework for family caregiving and public health and a report that we are releasing. And a big thank you to our partners for this work in partnership with the National Association of Chronic Disease Directors and with generous support from the John A. Hartford Foundation. My name is Mike Whitkey, and I'm the VP for Advocacy and Policy at the National Alliance for Caregiving. I've been on the team for nearly 7 years, leading our policy and advocacy work. And to get started here, we're going to go through a series of panelists who we'll introduce throughout the course of the event, but we're going to start with the President and CEO of the National Alliance for Caregiving, Jason Resendez. Jason is the President and CEO, and he leads our research, policy, and innovation initiatives to build health, wealth, and equity for America's 53 million family caregivers. He's a nationally recognized expert on family caregiving, aging, and the science of inclusion in research. And in 2020, Jason was named one of America's top influencers in aging by PBS's Next Avenue alongside Michael J. Fox and Surgeon General Dr. Vivek Murthy. Jason, go ahead and take it from here.
Hi, Mike. Thanks so much for that kind introduction. Lauren, if you could put a first slide, perfect. And thank you to all of us for joining us this morning for the release of this agenda-setting report on the actions that the public health community can take to support family caregivers. We at NAC, and I'm sure all of you understand that family caregivers are a population, a community that deserves and urgently needs tailored supports and services to make the care that they provide and that we all rely on possible. From the moment we take our first breath to the moment we take our last, caregiving connects us all. But that doesn't mean that it couldn't be easier with the support of public health departments, communities, health systems, and employers. Next slide. Our research with AARP Caregiving in the US 2020 makes it clear that care has far-reaching impacts on individuals, families, and communities. More and more Americans are identifying as caregivers, with the number reaching 53 million in 2020, up 10 million from 2015. Next slide. In tandem with this increase in prevalence, caregiver hardship is increasing as more and more caregivers are reporting difficulty in coordinating care. Next slide. And more caregivers today report that their health is worse than just a few years ago. Next slide. And when we look at the public health data collected by the CDC and analyzed by our friends at the National Association of Chronic Disease Directors, we see that caregivers across the country are navigating multiple chronic diseases while providing care. In most states, more than 1/3 of caregivers report facing this reality. Research finds that caregiving, particularly high-intensity care, contributes to a higher risk of chronic conditions and serious illnesses such as Alzheimer's disease and other dementias. Caregiving in the US also makes clear that women of color are more likely to find themselves in high-intensity care situations. Caregivers of color are more likely to report negative health impacts and financial impacts due to caregiving, making caregiving one of the most under-addressed drivers of inequality in this country. Next slide. We predict that these issues will grow as the prevalence of caregiving increases in the coming years. The data makes it clear we must make caregiving a public health priority. In doing so, we can improve health across the lifespan and advance health equity for millions of family caregivers. That's why I am so excited to share this new framework with all of you and why I'm grateful for the support and partnership of the John A. Hartford Foundation and the National Association of Chronic Disease Directors. We look forward to working with the public health community, many of are represented on this webinar today, to ensure that we can catalyze the resources and coordination needed to bring life to these actions. It's going to be a tough road, but as my civil rights hero Dolores Huerta once told me, we have the power, the people power, to make anything possible. And one of those people making this work possible is with us today, Kristi Kristi Pier is the president of the board of directors of the National Association of Chronic Disease Directors and director of the Center for Chronic Disease Prevention and Control at the Maryland Department of Health, leading a team of 20 staff positions to improve the health of Marylanders and reduce the burden of chronic disease across the state. Ms. Pier has worked in public health for more than 20 years and worked extensively in diabetes prevention since 2007. With that, I'll turn it over to Kristi.
Thank you. Good morning. I am pleased to represent the National Association of Chronic Disease Directors today for the launch of the first ever report on chronic disease, family caregiving through a public health lens. Family caregiver health and wellness is a critical issue to be addressed. More than 40% of family caregivers have 2 or more chronic diseases themselves, and 23% of them find it difficult to take care of their own health. Of those family caregivers who report difficulty in taking care of their own health, 60% report that caregiving has made their own health worse. As a chronic disease director, I believe it's crucial we address the comorbidities and lifestyle risks of those caregivers of persons with chronic conditions. We value the contributions of so many NACDD members and partners in the development of this report, which clearly outlines recommendations to integrate caregivers and caregiving into public health practice. On behalf of NACDD, we are pleased to partner with the National Alliance for Caregiving and the John A. Hartford Foundation to address the important public health issue of family caregivers, affecting the lives of millions of people, not only for those receiving care, but also on the lives and the health of the caregivers themselves. And I'll turn it back over to you.
Great, thank you. And next, we're going to hear a little bit more about the role of philanthropy in seeding caregiving and public health partnerships by hearing from Jane Carmody, who is a senior program officer at the John A. Hartford Foundation, which is a national private foundation dedicated to improving the care for older adults. As a senior program officer, Dr. Carmody works with foundation leadership and staff to guide and support grant-funded initiatives in the United States in 3 priority areas: age-friendly health systems, family caregiving, and serious illness and end of life. Jane, go ahead.
Thank you so much, Mike, and such an honor to be here. And I'm trying to get my my screens to work here. And I am trying to share it. Just a minute here. Sorry about that.
Okay.
Lauren, I might need your help.
Do you want me to share them, Jean?
Yeah, if you wouldn't mind going ahead.
Sure.
Thank you so much. I appreciate that. I even had a course from Lauren to begin with. Oh, I'm so privileged to be here, and thank you so much, Mike, for the introductions, and Jason, information, and Kristi, what powerful information that you and your organization have and work on. I am here on behalf of the foundation, on behalf of Scott Bain, who has supported this work, and on behalf of Ronnie Snyder, our Vice President Program, and they all send their regards, and I'm happy to be presenting information about the foundation. And next slide, please, Lauren. The foundation has been supporting aging and health since 1982. Our grants have totaled over $600 and some thousand dollars over the course of the time to establish the field of geriatrics. We're a private philanthropy. We are based in New York City, but we fund nationally, and our money comes from the A&P grocery store, from the Hartford brothers, John A. and George. Next slide, please. Mike, you've already mentioned this, so we don't have to go through it again, but we are very honored to be a part of this, because one of our priority areas, although they all intersect, is family caregiving. So next slide, please. I like to talk about this because you've already mentioned it before in the report, of course, great information, as well as Kristi just mentioned it, but we are growing older as a nation. And as we age, we develop more chronic conditions. Approximately 85% of adults have at least one chronic health condition, and 60% have at least two. And of course, as you noted already, Kristi noted that then that means family caregivers are providing care for people who have chronic conditions, and they have chronic conditions themselves. And looks like it continues as they age, continues to grow. So for older adults, then they have higher rates of healthcare use and thus related harms like multiple medication prescriptions, immobility, and care that is fragmented and can be at cross purposes, discoordination. And so that is something that this report also addresses. So next slide, please, Lauren. I mentioned the age-friendly communities because they're trying to create, the World Health Organization started this a long time ago, I think in 2006, and then the AARP picked this up for the United States in 2012, and trying to create age-friendly communities so that everyone can live well where they're growing, where they are and growing up. Livable communities, as you can see here, and probably some of you are very familiar with this. So this is where family caregivers live well. So what our president, Terry Fulmer, says is that you can't have an age-friendly community without an age-friendly health system. So next slide, please. The age-friendly health systems movement was started in about 2017. The ideas were forming in 2016. So 2017, they are building a movement so all care with older adults is equitable and age-friendly. It is guided by a set of evidence-based practices of 4 M's I'm going to mention briefly next, causes no harm, and is consistent with what matters, which is so important to what matters to their family caregivers as well. There are over 2,800 hospitals, office practices, nursing homes, and convenient care clinics that are providing 4M care. So next slide, please. The 4 M's, some of you, if this is new, some of you that is a refresh, it is the 4 M's of care, evidence-based practices that includes what matters, which is the driving theme in all of this. Medication, many of our older adults and caregivers managing their medications are 16, 17 maybe medications that they're taking per day. I think there's a state survey on how many are taking medications and how many. That all has to be tracked and ordered and reordered and pick up at the pharmacy, and that's all usually family caregiving doing a lot of that work. Mentation, which means, you know, is the person depressed, being screened for depression, being screened for delirium, which is an intermittent type of confusion, and then dementia. And then of course mobility. We know mobility is key to keeping people healthy and up and active, and in some cases prevention of many of these chronic conditions. So you'll see the age-friendly link there, and these slides will be shared or available. Next slide, please. We work with age-friendly care, also with the age-friendly public health. Our president had a large convening in 2017 with a number of people across the nation, as well as in Florida, because they have a high growing number of older people in that state, and discuss, is there a public health role in aging and healthy aging? And they decided that there was, and it was important for them to be involved. Prior to that, well, and still, public health has focused mostly on maternal child. And when you think about our longevity, in most part, it's thanks to public health for creating the conditions for us to live longer, and we want to live longer well. So the focus on aging is somewhat a new focus for public health, and it's growing strongly, and that's kind of what we want to talk about. And Mike will talk more about that now that the report, this great report, is out, and what more we can do with that work. There is the 6 C's of healthy aging are listed here for you. You can have these slides. I won't dwell on them, but there's also a way to be recognized. States can be recognized. New York was the first state to be recognized. Local departments can be recognized. For example, Sarasota in Florida is a recognized, advanced recognized exemplar county for the work that they're doing with healthy aging. And then this is something we can all do. I'm actually a champion for age-friendly public health systems because I attend their webinars and I learn more about what public health can do and what I can do to support. So I just wanted to let you all know you could sign up and be an age-friendly champion. And the next slide. So one of the things that the foundation has looked at, well, then how does all this connect? And so an age-friendly ecosystem is being aligned and dedicated to improving lives of older adults and their families. And this has been kind of organized under an age-friendly program, services, employers under the Age-Friendly Institute. And I got the link there for you, just kind of being formed, kind of a TripAdvisor, Yelp for older age-friendly programs, whether it's employers, there's a certification for employers, public health we already talked about, cities and communities we talked about, health systems, and then there's also one about universities. So next slide, please. So we think of ageism across all of our work because there's ample evidence to show that ageism has a real and negative impact on health. 1 in 5 adults report experiencing ageism in healthcare, and it leads to both under and over treatment. And we all have a role in redefining aging and the negative biases against getting older. That's not only true of the society, but our own selves. The way we think about our own selves as aging can impact negatively our healthy aging lives. So you can start by talking about aging as a natural process, acknowledging contributions of older adults to society. It's not a problem to be fixed or a disease to be cured. And you can get help and you can get information here on how to reframe your conversations. One of the first things that they'll tell you, not really the first things, but one thing that's kind of interesting is that just go to the card section of any store and look at the cards and look how aging is noted, over the hill and black cards and that sort of thing. So one of the first things you can do yourself is not to participate in those kind of cards and not to give them. So next slide, please. Then I want to get back to what's bringing us here today. And that is this amazing report bringing public health and family caregiving together. And Mike, we will be working more with TIFA, Trust for America's Health, on this work. But we are very pleased with the report and what we can do with this report. So for example, I just kind of listed through, and won't go each of them, the major sections of the report and what public health can do in this space. For example, under 1.3 with public health awareness, one of the things that Trust for America's Health has done with Health and Human Services is to have regional calls with each of the, across the country, each of the regional leaders, both for aging sector as well as public health. And we talk about what solutions there are for aging, what they're doing about aging, and then it leads to an aging national summit. So we can already have conversations and increase public awareness through that avenue. And then the next slide, please. When you talk with public health, when you have your public health yourself that are attending, I'm always impressed and amazed when we have a conversation with them. We just recently had a focus group. We with Trust for America's Health had a focus group that I attended on elder mistreatment, for example, and family involvement in that. And the immediate thing that public health does is they go upstream. So their immediate thinking on that aspect, what can they do with caregivers? What can they do with communities to help solve and prevent any kind of and help prevent elder mistreatment in that case, but also to help improve caregiving. One of the programs also that we talk about in expanded service delivery, primary care, public health, we also support best practice caregiving, which is a development of evidence-based practices that anyone can, any profession or organization can pick up and improve so that they can support family caregiving. In this case, it's about dementia family caregiving, but will be expanded to all kinds of family caregiving principles. And so Mike will be tying those two together. The upstream, I just want to mention again, as public health always thinks, what can they do up here to prevent, the downstream work? And I'm going to go to the next slide, Lauren, and I'm going to end and thank you for the opportunity to be here today, Mike. Thank you for this great report. We're going to be able to do a lot of work with that. And I will turn it over to Mike, and thanks everybody. Appreciate the opportunity to talk today.
Thanks so much, Jane. Great overview. I'm going to pause for a minute and have my slides pulled up while I do an overview of the framework and a little bit of background around the creation of the report before we get into some more specifics here with our other speakers. Okay. All right. So what is the problem we're trying to solve? This is where we're starting out here. The importance of considering family caregiving from a public health perspective is relevant and more timely than ever. Family caregiving is an important public health issue, not only for those that they care for, but also the caregivers themselves. They face an increased risk of deteriorating health and financial insecurity, making the role of caregiving itself a social determinant of health. Their ability to provide care and their effectiveness in doing so will, however, depend on some fundamental changes to the extent we recognize them as formal contributors to the health for those that they're caring for. And this is going to require us to integrate them into formal provider systems and provide support that recognizes their risk factors. And we really do need an expanded support infrastructure for family caregivers. So that's the problem we're trying to solve here. And you can go to the next slide. So this is the report, Chronic Disease Family Caregiving Through a Public Health Lens. It's a framework for family caregiving and public health. And the current national landscape brings with it a unique opportunity to leverage the recent work that has been done to establish and implement policy recommendations around facing family caregiving. And two critical aspects in the policy landscape highlight this opportunity. So the first one is COVID-19. The COVID-19 pandemic has made society more aware of the contributions that family caregivers provide and the hardships they experience. And the second aspect is the Recognize, Assist, Include, Support, and Engage or Raise Family Caregivers Act requires the Secretary of Health and Human Services to develop, maintain, and update an integrated national strategy to recognize and support family caregivers. So as the National Family Caregiving Strategy is being finalized, and as public health reforms in the post-COVID-19 era are being examined, the framework described in this report offer actions that can be taken to elevate family caregiving within the public health system. You can go to the next slide. So NAC and the National Association of Chronic Disease Directors established a working relationship to develop a plan of action to expand family caregiver support, the family caregiver support infrastructure within the public health sector. We envisioned a framework that would identify the appropriate mechanisms and practices which could be administered to implement family caregiver supports via entities such as public health departments, community-based organizations, faith-based organizations, direct care workers, insurers, healthcare providers, and employers. This framework offers an action-oriented approach to strengthening connections and coordination and provides policy recommendations, implementation opportunities, and messaging content aimed at enhancing the national family caregiver support infrastructure through a public health lens. You can go to the next slide. So the framework was designed in tiers to address actions that are likely to be driven by different sectors of the public health system. The first tier focuses on data, research, and awareness activities most effectively driven at the national level. Objective 1 here is to gather timely and essential national and state level data to assess and monitor the health status of family caregivers and factors that influence their health outcomes and disparities, and evaluate family caregiver support and education programs to determine accessibility, effectiveness, equitability, and impact. And the second objective is to integrate and improve family caregiver research and literature within schools of public health, professional public health associations and institutions, and to evolve and adapt the systems wherein family caregivers interact, as well as the future public health workforce focused on care and support for those with serious or chronic conditions. The third objective is to implement messaging through public health channels to inform and educate systems involving healthcare, social services, employers, and emergency response officials that underscores the essential role of family caregivers and the importance of maintaining their health and well-being. The second tier focuses on services and care support activities best implemented at the state or local level. Objective 4 is to strengthen, support, and mobilize communities and partnerships to implement policies and practices that ensure the health and wellness of family caregivers, as well as the persons receiving care, by convening multi-sector stakeholders. And objective 5 is to increase funding and capacity for home and community-based services that are critical for family caregivers, including home care and direct care services, transportation, congregate and home delivered meals, and family caregiver support. So to get into more specifics, we'll now look at how this framework may look in action. I'm going to turn it over now to Leslie Best, who's a senior public health consultant with the National Association of Chronic Disease Directors. Leslie Best has more than 40 years of experience in health and human services in Pennsylvania. For 9 years, Leslie served as the chronic disease director for the Department of Health, where she directed statewide planning and program implementation for the divisions of health risk reduction, cancer prevention and control, nutrition and physical activity, and tobacco prevention and control. Leslie served as the president of the NACDD Board of Directors in 2011 and has been a senior public health consultant with NACDD since 2014. Go ahead and take it from here, Leslie.
Okay, Mike, thank you. I'm gonna share my screen, get this rolling here. Well, good morning, everybody, and thank you very much for being with us today. I'm going to be talking a little bit about the activities that led up to this report and some potential implementation strategies. So we think that by expanding the national caregiver support infrastructure into the public health sector, we can reach caregivers over a range of chronic conditions, from Alzheimer's and related dementias to cancer, ALS, stroke, and heart disease. This approach not only views caregivers as a means to improve health outcomes, but also views caregivers as a potential at-risk population. The Essential Public Health Services is a well-recognized framework for carrying out the mission of public health. And the effort to better integrate family caregivers into public health is also in line with many of the 10 essential public health functions. I've selected 5 here that I think are most relevant to the framework and that are clearly reflected in the work of chronic disease programs in state health departments. So how did we get here? When we first started considering an approach to a potential pilot project to implement this public health approach to caregiving, we first obtained guidance and feedback from experts in the field of chronic disease, aging, caregiving, and public health. We wanted to learn how family caregiver services and messaging tactics and data collection efforts could potentially be administered. We wanted to learn how family caregiver data collection, messaging, and service delivery could best be implemented. And we wanted to know how public health leaders could prioritize the recommendations outlined in the framework. So between October and December of 2020, we conducted web-based surveys of state chronic disease directors. And in March and April, we conducted 2 focus groups. One was of chronic disease directors that agreed to participate in a focus group as a result of the national survey. And also the second focus group was selected NACDD consultants with many years of experience in public health, aging, and health management. And in June of 2021, we conducted 2 thought leader roundtables. So some of the survey findings and key themes we found is that many states are already trying to address caregiving in various ways. When we asked them what are some of the conditions that they see most frequently in their caregiver world, we got the highest responses were in old age and aging, cancer, behavioral health, physical disability, stroke, and ALS. So there's a wide variety of chronic conditions that chronic disease directors are already aware of and may be working within their program areas to address. Some key themes that emerged were potential funding streams, where the money is and where it isn't. Stakeholders, there's a wide variety of stakeholders out there that could participate in this. State health departments are very experienced at convening diverse stakeholders as part of all of their chronic disease prevention and control programs. Data collection, strengths and challenges, and messaging and message content. We have, again, diverse audiences for education and awareness, including caregivers themselves, employers, and primary care practitioners. So I'm going to go through a couple of implementation options across the tiers that Mike described. Any proposed pilot program with the state health department will be focused on building and supporting partnerships with the goal of implementing family caregiver specific recommendations out of the framework. The strategies should create the evidence-based need to advocate for appropriations sufficient to build sustainable capacity that will serve family caregivers across a range of chronic conditions. So as Mike mentioned, Tier 1 recommendations focus on public health data gathering, research, and awareness, while Tier 2 is focused on service coordination and delivery across sectors. I'm going to give you a couple of examples from each one about some potential implementation activities. These are included in more detail also in the report. So when we talk about crosswalking the recommendations across state plans, every state has a state health improvement plan, comprehensive cancer plan, a chronic disease plan, and a state plan on aging. Those need to talk to each other and integrate and coordinate both recommendations for caregivers and data collection. There's also an opportunity to collaborate with schools of public health, not only to improve data collection, but also to have caregiving included in curricula for our new public health workforce. Under research and evaluation, some ideas are to collaborate with employers to understand how many of their employees are caregivers, how caregiving affects their lives, and how can we expand existing worksite wellness programs to link caregivers to resources. We'd like to research employment policies on family caregiver supports, and again, convening a multi-sector stakeholder group to provide guidance on the pilot program implementation and evaluation. In terms of public health awareness, part of the pilot program would be to assess the capacity of chronic disease programs to include information and awareness as part of their chronic disease prevention messaging, and developing those diverse messaging that make them relevant to different groups such as healthcare providers and employers about the health risks and economic risks faced by caregivers. Again, under service coordination, we talked about a multi-sector coalition under Tier 1. Some potential partners that could work out in a pilot program include caregivers themselves, primary care practitioners, representatives of rural communities and rural health, schools of public health and social work, and employers that can mobilize communities and partnerships to implement policies and practices that ensure the health and wellness of family caregivers. The pilot program would include outreach to underserved communities and to collaborate with their leaders to identify the services and lack of services to promote coordination and improve capacity. The goal of the pilot program would be to coordinate existing local supports and services to develop an integrated, coordinated system of care, focused on addressing social determinants of health. Once again, in terms of service delivery, an integration with chronic disease programs, the state health improvement plan, and community-based needs assessments that are conducted, I think, every 3 years now. The pilot program would support the selection, dissemination, or customization of an evidence-based programs to support family caregivers. Many of the work done in public health is evidence-based. For example, the community guide lists a variety of evidence-based interventions on a variety of chronic conditions. Is there something in there that could be customized or really utilized to support family caregivers? And establishment of partnerships among caregivers, community-based and faith-based organizations, and state, county, and local health departments to both expand family caregiver programs and establish new and innovative approaches to reach family caregivers across a wide range of chronic conditions. And thank you very much for the opportunity to speak to y'all today, and I'm going to turn it back to Mike now.
Great job, and thank you for giving us some details on how this framework can come to life and be implemented in real world scenarios. So next, what we're going to do is we're going to hear our next speaker is going to provide a case study by sharing some work that's happening within the Public Health Center of Excellence for Dementia Caregiving under the BOLD Act. Dr. Lauren J. Parker is an assistant scientist in the Department of Health, Behavior, and Society at Johns Hopkins Bloomberg School of Public Health. Her research examines how home and community-based supports can be used to address the cultural needs of African American and Hispanic caregivers for people with dementia. Dr. Parker, go ahead and take it from here.
Thank you for that introduction. I'm just going to go ahead and start sharing my screen. Okay, so I hope that you see the title slide. So as you mentioned, I'm Lauren Parker, and today I'm so delighted to present on behalf of the BOLD Public Health Center of Excellence on Dementia Caregiving. So I really like to think about how do we get here before we talk about what the BOLD Center is. So in December of 2018, the Building Our Largest Dementia Infrastructure was passed into public law. This law enabled funding to develop the Public Health Center of Excellence to address Alzheimer's disease and related dementias. The activities of the BOLD Center are designed to create a uniform national public health infrastructure with a focus on three key issues, such as dementia risk reductions, early detection of dementia, and then for our center specifically, as given in the name, dementia caregiving. So our center is very unique in that it allows us to provide resources to state, tribal, and local public health agencies when they're developing their dementia caregiving focused programs. Some of the activities that we provide are, we improve access to evidence-based programs and practices. So if you go to our website, what I'll share on a later slide, you can go into our website and you can find access to programs that have been demonstrated to improve or to assist with caregiver needs. Another service that we provide is that we provide connections and collaborations among public health agencies and a host of service organizations. On our leadership core, we have a variety of organizations at the national level who are engaged and passionate about helping public health agencies developing their dementia care supports. And then lastly, we provide technical assistance for identifying, implementing effective public health interventions and strategies. So if you're a public health agency and you're saying to yourself, you know, I really need assistance with developing a program or getting a program up off the ground, that's what we're designed to do. And that's what we want to help you do, is that we want to help you identify programs to fit your specific needs, because we know all states and all communities might have different needs. So that's a part of our goal, is to help you all think about how to develop a program and then also to implement a program. So what are some of the ways that you connect with us? I think one of the greatest ways that we connect is, because we're all using this resource right now, is on the internet. So if you go to bolddementiacaregiving.org, you can stay connected with us. We have a variety, we have a host of information on our website. On the website, you can request technical assistance. You can access different resources and materials. Our center has put on a variety of webinars and seminars over the last 2 years, and all of our webinars and seminars are posted online. And the PowerPoints, the resources, the contact information for all of our previous webinars, seminars, and other programming are online. And then also you can stay up to date with our different activities, which I'll share some of those on the next slide. And if you're a little bit more savvy on the internet, you can follow us on Twitter. We're very active on Twitter with highlighting the services and activities that we provide. And on Twitter, you can follow us at PHCOE_DC. So I would be remiss if I didn't highlight some of the activities that we have coming up. We have an activity today, or an event today, excuse me, at 12 o'clock. It's not too late to register for this event, and it focuses on public health and faith. And we're talking with public health practitioners and also faith leaders on where's the connection between public health and also faith communities, and developing and reaching caregivers for those people living with dementia. And this is a 3-part series. The event is today, and then we have other events coming up. One exciting event that we have coming up in November is looking at stigma and dementia caregiving. And this will be an exciting webinar, because we're thinking about how a lot of people might face stigma who live with dementia, and how practitioners or providers or care partners for people who are living with dementia, how they might manage the stigma that they face. So please, please, please follow us on Twitter or visit our website. We are here to help, and that's our goal and that's our passion. So always helpful, always happy to offer a helpful hand. Thank you.
Great, thank you, Dr. Parker. Okay, so now we can turn into a Q&A session here. We have an opportunity for some audience members to be able to ask questions and to certain panelists. If you have questions for specific panelists, please direct them please type in the Q&A chat box what your question is, and if you have a specific panelist that you would like to address your question, please let us know who that is. And if not, I can try and direct as best as possible. And as we're letting the Q&A chat box populate, I noticed that there are already a few questions about how people can get access to the slides and to the report, which will all come out in an email after this event. We'll all package that up together nicely, but the report is currently online at caregiving.org. That's NAC's website. You can find it there, and we'll try to make sure it gets disseminated more broadly beyond this event as well. And so just to jump into the Q&A section here, the first question is, do we have disaggregated data for caregivers of those they care for across age, immigration status, race, ethnicity, gender, etc., so we can see how best to focus action against this framework? And I'll just start by saying that this is something that we need more of, and that's one of the actions that we call for in this report. Over the last year, in 2021, the NAC specifically has done some work in this area in partnership with the Diverse Elders Coalition. So we released a report last year that highlights data that was taken and gathered through our Caregiving in the US survey that we do every 5 years in partnership with AARP, and broke out the data based on different diverse populations, and gives a high-level overview of what we do know through those surveys that were conducted. But I do think that there's more work that needs to be done here. And then the DEC also released a report last year that looks at some surveys that they have done within diverse populations that exist within their membership. So there is some work that we've been involved with in the last little while here, but I would like to ask Jason and Dr. Parker if they want to address any of the points from this question as well.
Yeah, well, I would turn it over to Leslie. I mean, I think we have our Caregiving in the US data is a great resource where we are able to disaggregate. We don't look at it by immigration status. That's an area for growth for us. And I think for the field, as Mike mentioned, we have a vision for driving data advocacy and accountability to help us better understand caregiving across the lifespan and across communities. But I wonder, Leslie, given your expertise here, we're thinking about behavioral risk surveillance survey data, for example. What are we able to understand from BRSF data and from a subgroup perspective, but then also from an immigration status perspective?
Well, thank you, Jason. The Behavioral Risk Factor Surveillance System is an annual survey conducted by CDC in collaboration with state health departments. It's a random digit dialed telephone survey of people 18 and older. And I put a link in the chat room to the NACDD report on caregivers. That's data from the 2015-2017 BRFSS. I think we're going to be able to update that this year because more and more states have been implementing the optional module. In the BRFSS, there's a core module that CDC requires all states to administer, and then states have the option to include additional questions depending upon the priority within their state. And I think in 2021, we had 40 states that included the optional caregiver module. So we will be able to update that data. In the link to the report that I sent out, there is data there on racial and ethnic background of caregivers, both depending upon the issues they reported with their own health, as well as planning for future care for the person that they're providing care for. We do not have immigration status included in there. That's really not a question to be asked on the BRFSS. So if you want to take a look at that report, I think you'll see a breakdown there, not solely by demographics, but the demographics are spread across the different questions that were asked.
And I wanted to see if Dr. Parker had an opportunity to respond, if you have any thoughts here as well.
No, I have nothing to add to that information that was already presented. Thank you.
Okay, thank you.
I think it makes a good point, you know, when we think about this data, even though the data is there, how are we leveraging that data to look at and understand the challenges that we face when it comes to inequities? And so I think that's a challenge for the field, to better leverage data with a focus on understanding and better servicing populations that we know are disproportionately in caregiving roles. And as a result of those caregiving roles, facing higher rates of chronic disease, you know, higher rates of navigating complex care with fewer resources. And so that's a challenge to the field. It's a challenge to us. It's one that we share and will continue to work on. And I think this lends itself to the next question, which I thought was really interesting. Do you consider caregiving a social determinant of health? I see Dr. Parker smiling. So I will give you our opinion. It's clear that caregiving has consequences, that caregiving shapes social inequity, economic inequity. And so I think from our perspective, caregiving is emerging as a social determinant of health that makes so much else in life more difficult when you're also providing care. It's an honor. It's particularly communities of color report a high level of cultural fulfillment from providing that care, but it doesn't make it easy. It doesn't mean that the health data is the health data. It has impacts from a healthcare and economic perspective. So I'd say it is emerging as a social determinant of health, but would love an expert opinion on that. And we'll turn over to Dr. Parker and anyone else that wants to jump in on that as well.
Yeah, I love that response, Jason. I would have to agree. I would categorize it as an emerging social determinant, especially when you think about how, as you mentioned, a lot of cultures really take honor in the fact that providing care, especially for someone who has provided care for them growing up throughout their entire lives. So I'm thinking about offspring relationships with a parent, for example, how it's an honor and it's a privilege to provide such care. But we also know that providing care, especially for people with chronic health conditions like dementia or Alzheimer's, for example, we know that it impacts the caregiver's mental and physical health. In addition, beyond impacting health outcomes, we know that sometimes people just do not have the resources or supports to really assist with the care needs that they have. So I would totally agree with the answer is yes, that it is a social determinant of health. And I really think that public health organizations and stakeholders and groups should really start to look at what can we do to support caregivers in a more meaningful way that really impacts and has positive outcomes for the caregivers, because we know that we rely on caregivers, and if it were not for caregivers, it would be such a larger impact on the local health systems that we have. So it's really imperative that we develop some type of supports and services to assist caregivers with their challenges and needs.
Yeah, I do think that this is an emerging issue. I think that there's room for debate, and I think that this is a good platform to be able to have this conversation. And I actually thought this would be a good question if for everybody in the panel to take sort of a shot at answering. So I would love to hear from some of the other panelists on their thoughts about this too.
I'll go ahead and start. I am not an expert by any means as Dr. Parker, but certainly from the foundation perspective, we work not only with public health systems, we also work with communities, with the area agencies on aging and the community-based organizations, of which there are thousands across the country, as well as the 622 AAAs. But we firmly believe that as we know, social determinants of health determine most of our health. And we know that family caregiving is key to that, whether someone can be at home and be living well. And as you mentioned, Jason, it is a joyful honor to be a family caregiver, but doesn't make it easy. But I'm so excited about the opportunity to discuss and to see your report, Mike, the report that the group put together, because it is really going to be helpful, and we will make sure that that is considered. I will mention, and I don't want to mix reports, but our team has also been working on with the RAISE Act, which is coming out, I think, as well, and that should also help supplement, amplify family caregiving throughout the country. So yes, definitely a social determinant of health.
And Mike, I would echo what Jane and Dr. Parker said, particularly about the upstream approach to addressing health problems that public health uses. This is getting at an upstream approach, because if it's not dealt with, the repercussions from increased chronic disease and an older population that might be impoverished because of lack of ability to work or to work full time and contributing their own funds to support the person that they're providing care to, will impact us at some time in the future. And so the time to address it with not minimal resources, but it's always much better to get ahead of the game. And I think this is an opportunity ripe to do that.
Thank you. And I'll just say, because Jane mentioned earlier the work that they are doing with Trust for America's Health and their age-friendly public health systems initiative. This is definitely a topic that I've heard come up within that conversation as well. And I have been introduced to some people within schools of public health who are bringing this language into the curricula that is being developed in those schools, in some schools of public health. So I think this is an emerging issue, and there is starting to be more rigor around the definition of what this means and how we can define this as a social determinant of health. But I do think that what we're trying to do here with this work is further that conversation. And then the next question here was, how can community health workers assist with implementing these programs? And the first thing that came to my mind when I saw that, and I would love to hear from Leslie or Kristi on this as well, but I think that one of the things we would like to see more of is language and priorities around family caregiving being implemented or inserted into state health plans, so that we can start to get some funding and some recognition around how we can actually implement these programs. Obviously, we would like to be a part of helping further that process through some of the pilot actions that we've outlined in this report, and that we would like to be involved with moving forward here. But I think that there does need to be some prioritization and then some funding to follow to assist with the sort of implementation of these programs. Leslie or Kristi, if you have additional thoughts.
I think community health workers are an essential part of the healthcare and education delivery system. And that comes under, it can be used frequently to reach hard to reach populations. And I think that in terms of education and awareness by a person who is accepted by a community can be a very effective way to get not only a message across, but also increase the understanding of the availability of culturally appropriate services. So they definitely have a role to play.
Yeah, I agree. And especially the community health workers. And I know a lot of states, and we're one of those states, are trying to formalize some of the criteria and the certification, et cetera, to professionalize and support those community health workers. I also think that, going back to your comment about integrating the caregiving into work plans, into action plans, and really kind of thinking that forward of there's a place for that in probably all of the chronic disease work that we're doing, and not just, I think the natural fit is is in the cognitive health and dementia plans, but it you know, as we're seeing, you know, maybe repercussions from long COVID, et cetera, we should be really forward thinking about how we place caregiving into the work that we do in our chronic disease programs.
Thank you. And anybody else in the panel that would like to take a shot at this?
Yeah, I think it's, I agree. I mean, community health workers should be an essential part of the public health team and of care teams, and helping to drive the coordination of access to services and to be an extension of services. I think there's a long way to go from recognizing the importance to actually driving that connectivity, right? There are reimbursement issues. Kristi highlighted some of the certification issues, which, you know, that's a double-edged sword in how we think about certification for community health workers as a barrier for, you know, lay community members to play that essential role. At the same time, looking to build economic opportunity through professionalization. So I think it's a really important area that deserves a lot more attention from a caregiving perspective and from a reimbursement perspective as well.
Okay, thank you. I think we have time for one more question here. We're not going to be able to get to all the questions, but we will do our best to try to respond in post. And we're also happy to have more conversation after this email, or after this webinar. If anybody would like to send us an email, we can direct questions either to different panelists, or we can help answer questions. And all of our contact information for the National Alliance for Caregiving team can be found on our website at caregiving.org. But one thing I do want to pay attention to that's in the comment here is the question around, are there any plans underway to include young caregivers under the age of 18 in these efforts to build an infrastructure for family caregivers? And I do want to just acknowledge that we have a definition of the population that we're intending to sort of address through this report that comes from the Raise Family Caregivers Act, but that language does say that a caregiver is somebody who's, you know, of 18 or older. And so there is some work, I think, that needs to be done in figuring from a policy perspective how you can actually better work with underage caregivers. There's a sort of issue there that I think is really being highlighted by the work that the American Association for Caregiving Youth has been championing for a long time. And there's a lot of interesting ideas around how we can be working within the school system, as an example, to be able to reach these younger caregivers. And so I think there needs to be more work there. If anybody on the panel wants to address how we can be thinking more about these underage caregivers as we wrap up here, I would love to hear from anybody on the panel who has any thoughts.
Mike, I'll jump in and just say, as you know, our whole mission is about older people, but we do know that age-friendly crosses the whole continuum. And so I think that anytime we do something that we think is better for a one group, an older group, a diverse group, is better for everyone. And I think it's widely recognized that there are a lot of young caregivers caring for older people, as well as then the whole area of caring for children. Yeah,
our focus as an organization is really to look at caregiving across the lifespan. So I wanted to be able to address that question, because I do think it matters, and it's an ecosystem approach that we're trying to take here, as Jane was just saying.
Yeah, I was just reading an article about mental health needs and among teenagers, and lack of access to mental health services. And I think that I think it's important to take those issues into account when you're looking at those young caregivers who may be stressed already, and then have an additional a duty or responsibility to provide that type of care. And so I think for adolescents, this can be a particularly trying time. It's
a great way to wrap up here. And again, we'll we appreciate everybody for attending this event today, and we will follow up with a recording to the event and links to the report and the supporting materials. If you would please take a moment at the end of this webinar to fill out a quick survey to give us any thoughts or feedback you have, we would be very much appreciative. And thank you to all of our speakers, and thank you to the National Association of Chronic Disease Directors and the John A. Hartford Foundation for supporting this work as well. We'll talk to you soon.
Thank you. And thank you to Mike.